of big rooms. Would you like to tour around the unit? It's an awesome.
If we don't let
just the two.
not it.
Selecting just a bit ceremony. Okay, and what did you think the exhibition? Unit lens.
Doctors, and when we are talking about health education, we're talking about everybody else, the nurses, the allied health, the pharmacists, and all the people who are involved in any given healthcare system. So my task here as a chair of medical education is to develop the next generation physicians who will be serving this country, and also to support in an integrated interprofessional development, interprofessional training and education that Sidra will be adopting as part of its mission to become a beacon of health and education and research. The tripod of academia work hand in hand, and in the current academic ecosystem, you do not work in isolation, and you have to work with partners in education, partners in research, partners in healthcare provision, and that is what the single program multiple institution model is all about. One of, most of you know my previous role at Hamad when I led research, which I'm still working on over there, and now here I'm leading education. This bridging between Hamad and Sidra has started way back, and it will continue. We are only gonna add to it and strengthen it. In addition to Hamad, obviously, all our academic partners are involved. As Peter mentioned earlier on, primary healthcare is a critical partner. In addition to our academic partners, the two medical schools, the health schools at Qatar University, in addition to all the Hamad bin Khalifa colleges. In addition to that, we also will be working with the nursing college. So these academic partners will augment our mission, will help us in developing a sound academic health system that would serve women and children for Qatar. And as Abdullah mentioned, this is going to be the first children's hospital, and therefore we need to make it right, and we are intending to do it right, and we will.
Described earlier with Hamad Medical Corporation and the clinical teams involved in the women's service at Hamad for some period of time, some years. That planning will continue. There's a principle that we have adopted in the health system of Qatar with Hamad Medical Corporation and Sidra working together, which is referred to as single program, multiple sites. That is to say that we want a highest standard of care delivered whichever hospital a woman in labour chooses to use. And the teams are working together to deliver that principle of single programme, single quality, multiple sites as we open the new centre here, and of course as Hamad Medical Corporation opens its new Women's Institute very soon. So we will continue to work in partnership with Hamad Medical Corporation. It is envisaged that there will be an indication for primary care colleagues about which hospital is best served or best suited for particular conditions. And indeed, we have our particular areas of focus clinically in women's care, and Hamad Medical Corporation have particular areas of focus there. So we will want to play to the strengths that each of us have in our infrastructure, ensure that women get the right treatment, and if there's an option for choosing HMC or Sidra, then women really ought to be given, if possible, the choice. But we are continuing to work with Hamad over the changes in the system, which are very, very substantial, of course. Hamad at the moment Hamad Medical Corporation deliver over 20,000 births every year. About 17,000 of those occur in Hamad General Hospital. Hamad General Hospital will reduce the number of births seen at Hamad General. We will increase it to up to 10,000 births a year. And so this change across the health system needs to be very carefully managed, and it will be. And we, as I say, will play to the strengths of individual hospitals and teams according to the particular needs of women.